Hallux rigidus is a condition that affects the big toe, causing stiffness and pain. The term hallux refers to the big toe, while rigidus means rigid or stiff. Essentially, this condition involves the progressive loss of motion in the first metatarsophalangeal joint, or MTP for short, which is the joint at the base of the big toe where it connects to the foot. Hallux rigidus is a form of osteoarthritis that affects the cartilage in the big toe joint. Cartilage is a smooth, rubbery tissue that covers the ends of bones in joints, allowing them to move smoothly against each other. In hallux rigidus, the cartilage in the MTP joint gradually wears away, leading to bone-on-bone contact, pain, and restricted movement. As the condition progresses, bone spurs may form around the joint, which leads to limited motion and more discomfort. In severe cases, the toe can become almost completely rigid, and it can severely impact daily activities, as the big toe plays a crucial role in walking, running, and maintaining balance. Hallux rigidus is relatively common, especially among older adults. It's considered the most common form of arthritis in the foot, affecting about 2.5% of people over the age of 50. However, it can occur in younger individuals as well, particularly those who engage in activities that put repetitive stress on the big toe joint. Causes of hallux rigidus. The causes of hallux rigidus can vary from person to person. One of the primary factors is inherited foot structure. Some people are predisposed to developing this condition due to the shape and mechanics of their feet. For instance, those with flat feet, high arches, or a longer than average big toe may be more susceptible because these foot types can alter the way weight is distributed across the foot, potentially putting extra stress on the big toe joint. Overuse or injury to the joint can also contribute to the development of hallux rigidus. Activities that involve repetitive upward bending of the big toe, such as certain sports or jobs that require frequent squatting or stooping, can increase the risk. Traumatic injuries to the toe, like stubbing it severely or dropping something heavy on it, can also damage the joint and lead to arthritis over time. Age is another significant factor. As we get older, the cartilage in our joints naturally wears down, making us more susceptible to osteoarthritis in various parts of the body, including the big toe joint. This natural wear and tear process can be accelerated by factors like obesity, which puts extra stress on the joints of the feet and legs. Certain medical conditions can also increase the risk of developing hallux rigidus. Rheumatoid arthritis, gout, and other inflammatory conditions that affect the joints can contribute to the degradation of cartilage in the big toe joint. Symptoms of hallux rigidus. The symptoms of hallux rigidus typically develop gradually over time. In the early stages, people often notice stiffness or a loss of motion in the big toe, particularly when trying to bend it upwards, which is a movement known as dorsiflexion. This stiffness might be more noticeable in cold or damp weather. As the condition progresses, pain becomes a more prominent symptom. The pain is usually centered in the top of the foot at the base of the big toe, but it can sometimes extend into the ball of the foot or even the entire big toe. The pain is often described as a deep, aching sensation that worsens with activity, especially those that involve pushing off with the big toe, like walking or running. Many people with hallux rigidus report that their pain is worst when they first start moving after periods of rest, such as when getting out of bed in the morning or standing up after sitting for a long time. This start-up pain typically eases somewhat with movement, but may worsen again with prolonged activity. As bone spurs develop around the joint, people might notice a visible bump on the top of the foot near the base of the big toe. This bump can make wearing shoes uncomfortable, as pressure from the shoe can irritate the already inflamed joint. Some individuals find that they need to switch to shoes with a wider toe box to accommodate this swelling. In advanced stages of hallux rigidus, the range of motion in the big toe can become severely limited. Some people describe feeling as though their toe is locked in place. This restricted motion can affect gait, causing people to alter the way they walk to avoid bending the toe. This compensatory walking pattern can lead to secondary pain in other parts of the foot, ankle, knee, hip, or lower back. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of hallux rigidus. Diagnosing hallux rigidus typically involves a combination of physical examination, patient history, and imaging studies. When a patient presents with symptoms suggestive of this condition, a doctor, usually a podiatrist or orthopedic surgeon, will first ask about the nature and duration of the symptoms, as well as any factors that seem to worsen or alleviate the pain. During the physical examination, the doctor will visually inspect the foot, looking for signs of swelling, redness, or the presence of a visible bump near the big toe joint. They will gently manipulate the toe to assess its range of motion and the point at which pain occurs. The doctor may also observe the patient's gait to see how the condition is affecting their walking pattern. X-rays are typically the primary imaging tool used to diagnose hallux rigidus. These can reveal the extent of joint space narrowing, the presence and size of bone spurs, and any other changes to the bone structure around the joint. In some cases, more advanced imaging like MRI or CT scans might be used to get a more detailed view of the soft tissues and bone structures. The severity of hallux rigidus is often graded on a scale, with grade 1 being mild, with some loss of range of motion and mild pain, to grade 4 being severe, with significant stiffness, pain, and large bone spurs. This grading helps guide treatment decisions and provides a way to monitor the progression of the condition over time. Treatment for hallux rigidus. Treatment for hallux rigidus can vary depending on the severity of the condition and the individual patient's needs and lifestyle. In the early stages, conservative or non-surgical treatments are typically tried first. One of the primary conservative treatments is the use of appropriate footwear. Shoes with a wide, high toe box can help reduce pressure on the joint. Some people find relief with shoes that have a rocker bottom sole, which helps the foot roll through the step without requiring as much bend in the big toe. Orthotic devices can also be helpful. Custom-made orthotics can help redistribute weight away from the big toe joint and provide support to the arch of the foot. Some orthotics include a rigid insert that limits motion in the big toe joint, reducing pain during walking. Pain management is another important aspect of treatment. Over-the-counter non-steroidal anti-inflammatory drugs like ibuprofen can help reduce pain and inflammation. For more severe pain, doctors might prescribe stronger pain medications or recommend cortisone injections directly into the joint to reduce inflammation. Physical therapy can be beneficial for some patients. A physical therapist can teach exercises to improve flexibility and strength in the foot and ankle. They might also use techniques like ultrasound or electrical stimulation to help manage pain and promote healing. Some people find relief with alternative therapies like acupuncture or chiropractic care, although the scientific evidence for these approaches in treating hallux rigidus is limited. In cases where conservative treatments don't provide adequate relief, or for more advanced stages of the condition, surgery might be considered. One surgical option is chylectomy, which involves removing the bone spurs and a portion of the bone to increase the joint's range of motion. This procedure is typically recommended for earlier stages of hallux rigidus, where there's still some cartilage left in the joint. For more advanced cases, joint fusion or arthritis might be recommended. In this procedure, the damaged cartilage is removed, and the bones on either side of the joint are fused together. While this eliminates pain by preventing any motion in the joint, it also permanently stiffens the toe. In some cases, joint replacement surgery might be an option. This involves removing the damaged joint surfaces and replacing them with artificial components. However, this is typically reserved for older, less active individuals due to concerns about the longevity and durability of the artificial joint. A newer surgical technique called interpositional arthroplasty involves placing a spacer made of donated human tissue between the bones of the joint. This can help preserve some motion in the joint while reducing pain. Other than these treatments, there are several lifestyle modifications that can help manage symptoms. Regular low-impact exercise, such as swimming or cycling, can help maintain overall fitness without putting excessive stress on the big toe joint. Maintaining a healthy weight is also important, as excess weight puts additional stress on the joints of the feet and legs. Applying ice to the joint after activity can also help reduce inflammation and pain. Some people find relief by soaking their feet in warm water, especially in the morning when stiffness tends to be worst. Now, we want to hear from you. Have you or someone you know experienced symptoms of hallux rigidus? Do you have any tips or advice for others dealing with this condition? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.